Hi everybody, welcome back to the channel. My name is Kelly Troutman. I am a certified hand therapist. Today's video is part 3 of our hand therapy education series on carpal tunnel syndrome. If you have not seen part 1 or part 2, you can find those videos linked below. I would recommend watching them first. They're going to talk about kind of the anatomy of carpal tunnel syndrome and then also assessment or evaluation of carpal tunnel syndrome. So this video and this video series is specifically intended for therapists, physical therapists, occupational therapists, OTAs, PTAs, anybody with an interest in hand therapy. It is not intended for the general public or people that have carpal tunnel syndrome symptoms. If you do have these symptoms, go ahead and check out the playlist Carpal Tunnel Syndrome. You will be able to find some different exercise videos there, or, always I recommend following up with your primary care physician or with a hand specialist doctor or a rehabilitation professional so that they can advise you on how to best treat your symptoms. This video is focused on treatment of carpal tunnel syndrome or intended for therapists, so we can have kind of a discussion. I'm going to share with you what I typically do with carpal tunnel syndrome patients or what kind of things I'm looking for when I'm doing treatment. This is not the only thing that you can do for treatment. It is just a few ideas to kind of get you started. I know that when I was a new grad, it was always really hard to figure out how to treat different diagnoses and how to spend treatment time. So that's what this video is for. It is so that we can open up a discussion. All of us can kind of join the discussion and share below in the comments what treatment strategies that you use, or if you have questions or comments or anything like that. Let's all learn together. Without further ado, let's get into this video. So first and foremost, I'll mention splinting or orthoses. It can be very helpful for carpal tunnel syndrome to use a wrist cock-up splint. A lot of people can fit into prefabricated braces, so they can get like a prefab wrist brace at the drugstore. For a lot of people that works fine. You might have to help people kind of bend the metal insert because sometimes it actually can be putting pressure on the wrist, or it can kind of keep them in a weird position. So sometimes you can kind of help them by bending the metal insert to help it fit them better. For some people, those don't work very well. So certainly making a custom wrist orthoses would actually be probably pretty helpful for them. The facility that I work at, the doctor really prefers custom orthoses, which is really nice for us because we can make a nice custom splint for the patient. I recommend it at nighttime. I think daytime use, it really depends on the case, but I think most of the time, if you are able to educate the patient and kind of they're compliant with their activity modification, when you're awake, you can pay attention to the wrist position. So you shouldn't be putting your wrist into weird positions. At night while you sleep, we tend to be in all sorts of wonky positions. So if you can kind of help immobilize the wrist at nighttime, that can be really helpful. When you're positioning the wrist cock up, you don't want to put them back very far into extension like you would with maybe like a tennis elbow or something like that. You want them to be from neutral to 15 degrees of extension. So it's very, very slight amount, because if you put them too far back, that's just going to increase the pressure on the carpal tunnel. You may also need to include the MCPs in the splint. That's not something that I do on the first orthosis, but if after about 2 weeks the patient has worn their splint compliantly, they have noticed that there has not been any improvement or any change in their symptoms, then I will usually remake an orthosis, or I will recommend an orthosis, like a prefab brace online that includes the MCP joints. Because if you remember, sometimes the lumbricals, when we are making a fist, glide down into the carpal tunnel, and sometimes when people are sleeping, right, their rest position is going to be with the fingers relaxed and curled, so that can cause more pressure at the carpal tunnel overnight. So if you keep the MCPs extended as well as the wrist, they're not going to have lumbrical drift into the carpal tunnel, so that might help. So just something to consider with splinting. So in terms of manual techniques that I like to use for patients with carpal tunnel syndrome, we definitely are working some deep tissue massage, some myofascial release kind of techniques. We want to loosen up the forearm, the volar forearm. We want to loosen up the hand, the fingers. Sometimes their intrinsics are going to be really tight, so you may want to do some intrinsic stretching. You'll find that that is kind of classic for a lot of patients with carpal tunnel. You'll want to do probably some carpal mobilizations, compare left versus right, affected versus non-affected side, see if the carpals feel more stuck together or more tight on the side that is affected. That can also be pretty common. You can do some techniques to open up the transverse carpal ligament or open up the palm and kind of stretch things out. I like to teach people how to do some self-mobilizations as well, because they're only coming to therapy once or twice a week. So using tennis balls to kind of like massage the forearm. I do have a video on that too, so if you want to learn how to make your own tennis ball self-massage tool, you can go there. I'll put the link below. I think I've seen some different articles too, and I will link the article that I'm thinking of that shows like a really good transverse carpal ligament stretch. Essentially, you're going to put the hand on the wall, and then you'll kind of use your other hand to pull open the carpal tunnel. For some people, it's not accessible to be straight against the wall and then pulling back, but I will show you that right now. So this is the demonstration of that stretch. They're going to kind of put their palm flat against the wall like so. They're going to use their other hand to reach the fingers underneath the thumb and the thenar wad. Nice flat fingers, not pointed, keeping them flat, okay? So hand on wall, fingers underneath the thumb, and then they're just gently pulling back on the thumb muscle. So it's this motion, right? Pulling back gently while this side is braced. It's gonna help open up that transverse carpal ligament. For home exercise program and for active range of motion stretching, I tend to keep it fairly simple, especially at first. I usually start with tendon glides. You've probably seen these exercises before, but going through the hook, the fist, the flat fist, and then the platform position. They can do these exercises throughout the day. Sometimes I tell people to do it every time they wash their hands. Sometimes people prefer to do it, regimented 3 times a day. Those exercises are going to allow the flexor tendons to glide through the carpal tunnel and kind of create the most differential glide, which can help free up the nerve a little bit, help reduce the inflammation around the tendons that has kind of formed, and help prevent any adhesions or scar tissue in that area as well. I will sometimes progress to some different nerve like glides or some sliders. Personally, I don't like to do a lot of nerve tensioners, which means you are passively moving them and kind of passively tensioning the nerve. It's just not my preference to do that. I don't think there's anything necessarily wrong with it, as long as you know what you're doing and you're not, pushing them too much. But I do like to do some active nerve glides or some sliders. I like to do the duck and penguin nerve glide, which I will show you now. So they're going to keep their shoulders down and back, not raised, not hunched. They're going to have their hands down at their sides. They'll slowly extend the wrists as much as they can, bring the arms away from the sides to about 30 degrees, and then relax. Palms towards the back of the room. Wrists flex backwards as far as they comfortably can, and then bringing the arms back, again about 30 degrees, and then relax. They can flow through this movement 5 to 10 times, making sure that they don't feel any numbness or tingling or worsening of their symptoms. If they do, you want to ease back the movement or stop. I'm also a really big believer in doing postural stretching, foam roller stretches. So I like to have people do a lot of those kind of exercises, really working on opening up the anterior capsule, kind of pulling the shoulder blades back, bringing the chin back, because people tend to really be in this posture most of the day with all the things that they do. So if we can get them back in the right position posturally and proximally, it will take tension off distally. So those tend to be really helpful. I like to use foam roller stretches, anything in your arsenal. There's so many different posture stretches out there. You can do doorway stretching. You can really go crazy with it. If you need ideas for stretches, please comment below and I can help you out there. And yeah, so I really believe in a lot of like postural training, proximal training, and stretching, because I know that posture is probably one of the biggest reasons that we get compressive neuropathies, repetitive strain injuries, all those kind of things. So if you can really hit it hard with the postural stuff, it does tend to help really a lot. With that being said, I think education is also one of your biggest assets as a therapist, and one of your biggest responsibilities is to educate your patients. And that can be a huge part of what we do as hand therapists. So focusing on ergonomics, focusing on posture, focusing on activity modification, joint protection, all these things that you know can help your patient. And when I say ergonomics, I don't necessarily just mean sitting at a desk, right? Because we are dynamic creatures. We do tons of different activities through the day, tons of repetitive activities through the day, whether it be at work or hobbies, or just sitting watching TV. All these things are really important, and we have the chance to make an impact in their activities and their occupations throughout the day. So making sure that they are aware of their posture during different activities. You can have them take pictures of their work setup. You can have them, kind of video or record them doing a certain activity so you can watch it later and kind of go through it with them during your treatment session. There are so many different ways that you can take that on, providing them education, giving them pictures, videos, all these kinds of different things. If you have a setup in your clinic where you can show it to them or have them practice it, that's great. If not, kind of do the best you can, give them the education, do a telehealth session, watch them do it at home and give them critique on it. There's so many ways that you can help your patients, and really just empower them, right? Because you're not there with them 24/7. You're seeing them 1 hour to 2 hours a week, probably for a few weeks, and then you're not seeing them anymore. So you have to empower them to take charge of their life and to take charge of their injury, and know how to prevent it in the future and know how to make it better for themselves. So education is really underplayed, I think, and you have to get your patients to buy into it, right? You have to convince them, I'm not going to be with you forever. I can't, you're not here just to get a massage. Like, we need you to learn what you need to learn to make yourself better. Does that kind of make sense? Sometimes you got to be a little tough love with people. Some people are going to want to be really involved in their treatment, and other people just want you to fix them. So very openly communicate with them. I would say just right from the get-go, get them involved, have them set goals with you, and have them actively participate in their recovery and in their rehab. And then thinking about pain management strategies and modalities, I use modalities with a grain of salt. So I do think that ice and heat can be helpful, especially in relieving pain. Heat is always helpful before people stretch, or if they wake up stiff in the morning, before they do some exercises. Sometimes it helps a lot to warm them up. It brings blood flow to the area, right? So we can help stimulate healing. Ice can be really helpful if they've done a long day of work, if they have done something really repetitive, if they're feeling really sore, achy, have them use some ice. I know some people use contrast baths. I'm not against it. I don't think that it 100% works in 100% of cases. Like everything, we have to individualize the patient care. So you can tell people about it, you can have them try it, see if it helps. I've had some people swear by it and others feel like it's not that helpful, so it's worth a shot. But don't kind of count on that as like a protocol. I do tend to use ultrasound some. I would say that I don't necessarily believe that the ultrasound is fixing the problem. Yes, it stimulates circulation. Yes, it's going to help create a little bit of deep heat in the tissues. I personally tend to use ultrasound before I have the patient do stretches or nerve glides, because we can put the ultrasound into the carpal tunnel area. We can help loosen things up a little bit, get things gliding a little easier. I think that that helps them probably stretch a little bit easier. They think it feels good, so I'm fine with that. But I also don't do like 8 minutes of ultrasound. I do like 3, so I know it's not evidence-based. It's just enough to get a little bit of heat in there, kind of make them feel good, give me a chance to kind of catch up with things with them, and then have them do their active exercises after that. So that's my take on it. Feel free to share yours. I don't tend to use electric stim a ton with carpal tunnel syndrome. If people are very painful, then I'll sometimes try it because some people do really like it. They feel like it helps manage their pain. But you have to be careful, right? Anytime there is nerve involvement, especially in a superficial area where the nerve tends to be very close to the skin, because you can actually irritate the nerve more. So be very careful. Don't put the electrode right on top of the carpal tunnel. You know, some people do really find that it helps manage their pain, and that's totally fine. I think just kind of proceed cautiously. Again, we're all different. You have to treat every patient individually. You can't kind of develop like an exact formula for how you're going to treat each person, because we're all different. We all respond differently to treatment. I really like using kinesio tape or any kind of kinesiology tape. I just prefer kinesio tape after taking a class in it last year. So I do use that a fair amount. People tend to really like it. It feels good, kind of feels comfortable. You can help them feel a little more stable or kind of secure in the wrist, give them a little proprioceptive feedback to kind of keep their wrists neutral, helps open the carpal tunnel a little bit, and it feels good, right? So it's a little bit of like a pain management thing too. So that's just what I tend to like. And then thinking about strengthening, because I'm sure that somebody out there is wondering, I don't tend to do heavy strengthening regimes with people that are going through carpal tunnel syndrome, especially in their acute phases. And even when they're starting to get better, you can definitely start doing some strengthening. I'm not against strengthening by any means. I just don't think that necessarily it's helpful for them to be squeezing Theraputty or a stress ball. A lot of people feel like their hand is getting really weak. You'll hear that a lot, right? Which is typical because the nerve is being compressed. They're not getting maximum output of the hand. And you'll start getting, over time, atrophy or wasting, right, of the thenar muscles. A lot of people will kind of self-prescribe, and they're dropping things, right? That's another huge thing with carpal tunnel. People that are like, oh my gosh, I'm dropping everything. My hand must be so weak. A lot of times you have to kind of take people back a step, right? Because people will like self-prescribe grip strengthening exercises, and yeah, okay, you know, like it's not a terrible thing, but all you're doing in that is you're aggravating the tendons more, so it's actually working against you. So I never do Theraputty strengthening. I shouldn't say never. It would be unusual for me to do Theraputty strengthening or stress ball strengthening in conservative carpal tunnel syndrome patients, right? That's the key with this, conservative treatment, not surgical. I do like to do like wrist isometrics, because that can help your grip strength, but it seems to be a little bit less aggravating. I like to do proximal strengthening. That is really where I focus, because we need to strengthen the back almost always. We need to stretch out the anterior capsule, strengthen the posterior capsule, all those parascapular muscles, all of those stability muscles, the rotator cuff, all that stuff that keeps us strong in our posture. So I do like to do a lot of like Proximal TheraBand exercises. There's some isometrics against the wall, kind of doing some different positioning to engage our retractor muscles, our parascapular muscles, the lower trap, all those good things that we need. I do a lot of like TheraBand, like bilateral rows, or kind of rotating external and internal. You can do external and internal. It depends, obviously, right? It's not going to be appropriate for every patient, but I do think that that can be really helpful. Patients like it. They feel like they're getting stronger. They feel like it's something active they can do that's not just, stretching. So that's what I tend to do for my carpal tunnel syndrome patients. And certainly it depends case by case, right? Some people will need more strengthening or kind of different tailored program than others, but that's just kind of what I tend to lean towards. Get them away from doing grip training. That's all I gotta say. Okay, so this was a very long, talky kind of video, very rambly. Hopefully this discussion made sense. If you have questions, please leave them below. If you have comments, concerns, if you think I missed something, whatever it may be, please comment below. This is a discussion. This is not meant to be a lecture. Like, I'm not trying to like show you the only way to treat people, right? I'm just kind of going through some ideas, some things that I've picked up, have learned from other people, or kind of some little clinical pearls or tips or strategies that I tend to use. But please feel free to share below. We all benefit from learning together and from growing from each other, right? If you don't share, you're not letting us learn together. So please let this be an open discussion. If you have questions, concerns, anything, please leave it below. Thank you guys so much for hanging in there and watching. I know this was a very rambly video, and I hope to see you in the next one. If you liked the video, please give it a thumbs up. It really helps our channel to grow. And please subscribe if you enjoyed it as well. Thank you guys so much for watching, and we'll see you in the next one.